What's up, everyone? First video being back in the United States. I've been abroad teaching workshops overseas for about 7 or 8 weeks or so. Now I'm finally back on a consistent posting schedule with YouTube again. So this video, I want to discuss training hip external rotation at 90 degrees of hip flexion in varying degrees of hip abduction and adduction, or I should say horizontal abduction and horizontal adduction. When the femur is at 90 degrees of flexion, this is coined horizontal abduction, and then bringing the leg across the body is horizontal adduction. And training in this way really highlights the different roles that the hip external rotators play in different planes of motion. So if we shorten or lengthen these external rotators of the hip, we're thinking piriformis, the gemellus, obtrators, quadratus femoris, and even the superior fibers of the glute max, as well as the posterior fibers of the glute median min. These muscles are going to horizontally abduct the hip, as well as externally rotate the hip. So this exercise really highlights how placing a muscle in length or in a shortened position in one plane of motion will make the rotational demand of that muscle much harder. So if I'm doing a side-lying external rotation liftoff like this, the most mechanically advantageous position for the hip external rotators, the function of external rotation, is going to be with a neutral hip position. If I close down on the pelvis, get some length into the back of the hip, drive the femur posterior, it's going to make it much more difficult to perform external rotation because I'm creating length in these hip rotator muscles. Okay, I'm adducting when these muscles are abductors. So it's going to make this muscle much more challenged at its end range of motion to perform that liftoff. Whereas if I shorten these hip rotators and I abduct, it's going to be just as hard to perform that lift, but the sensation is going to be a bit different because now we have length through the adductors and we're shortened through the hip rotators. It's very interesting to go through different planes here of abduction and adduction when strengthening external rotation. If we wanted to maximize motor unit recruitment, we could do this with a neutral hip position. Add some ankle weights here, really get a decent lift. But if we want to really make it challenging in the lengthened position, I can roll my torso over, perform these liftoffs, or I can roll my pelvis away. So having some understanding of the anatomy and biomechanics can help guide decision making when we want to work in these different planes of motion. So what also is happening too is as I roll away, this drives the femoral head anterior in the socket. So external rotation requires that anterior glide of the femoral head in the acetabulum. If it's already there and it has not much room else to glide forward, it's going to make the position much more limited and challenging. As opposed to here, the femur is now gliding backward in the socket. So now these posterior capsule ligaments are going to be very taut, and again, making it difficult to perform external rotation because we're fully adducted and these muscles are now at length. Now to take this one step further, we can manipulate the frontal plane in a neutral hip position, meaning controlling the hiking and dropping of the pelvis. So in 90 degrees of hip flexion, which we've been talking about, we're talking about horizontal adduction, horizontal abduction. But in the neutral plane, now we're talking about hiking and dropping the hip. So typically, when the hip is hiked, those hip abductors and external rotators are going to be under more length. So if we can create a hike of the pelvis on this side, the downside, the working side, it's going to place those muscles in more length. So what I can do in a side-lying position is pull this top leg down. What that's doing is dropping the top side of the pelvis, hiking the bottom side of the pelvis. You could see this hip bone is below this hip bone. So now when I try to externally rotate, I can hardly get the leg off the ground, the foot off the ground. It's much more difficult because, again, now I'm working at a lengthened position in this frontal plane. If I scooted all the way back here, look how much I could lift, because now that femur has much more space to externally rotate it because it's not being lengthened proximally at the pelvis. So in my experience, just training in a mechanically advantageous position isn't beneficial for improving mobility. Your nervous system, your brain, it needs to understand how to function on all sides of the spectrum, in a lengthened position, in a shortened position, and a neutral position, in order for it to find center more effectively. So if we want the femur to be able to rotate effectively when it's perfectly centrated in the joint, then we have to teach the nervous system how to function on both ends of the spectrum, when the femur is glided all the way forward, or when the femur is glided all the way backward in the socket, okay? So understand how to make external rotation a bit more difficult for yourself and introduce more variability to the nervous system. This is how we improve external rotation long term, as well as incorporating some loaded stretching for those hip rotator muscles to improve external rotation. So give this exercise a try. Maybe try 5 to 10 repetitions in full adduction, 5 to 10 repetitions in full abduction. For these liftoffs, you can add ankle weights. You could place a block underneath the knee to make it a little bit easier. And then you could finish with maybe some neutral reps here as well. And then retest your external rotation afterwards. It should feel much more smooth. Of course, this concept comes into play as well with other muscles. Just because a muscle is an internal or external rotator doesn't mean it doesn't have another function in a different plane of motion. There's hardly any muscles that just function as hip rotators. I find this to be interesting when it comes to the glutes and external rotation specifically. I just wanted to use that as an example because of those triplanar functions of the glutes and how moving through different planes of abduction, adduction in both 90 degrees of hip flexion and a neutral position can make external rotation much more challenging.